Hello, my name is Silvia Aulet, and I'm with Angelica Alvarez. We are from the University of Girona, and we are going to present an ongoing research entitled, Is Pilgrimage an Essential Service? In the Faculty of Tourism of the University of Girona, we have been developing several researches connected to religious tourism, to spiritual tourism, and pilgrimage. For example, we developed one last year based on pilgrimage as a peace-building tool, and Angelica developed one based on the transformation of pilgrims during the Camino Ignaciano. So the main goal of this research is to answer the question if pilgrimage can be considered as an essential service or not.
So pilgrimage was basically one of the first forms of mobility for non-economic purposes that existed. So could this be maybe because men felt a special need not to only move to some place, but to create a path that would lead him to a much higher spiritual level? Probably the path formally offered the ideal space to have a meaningful experience with nature, with your thoughts, with your reflection, illumination, and a spiritual encounter. So it is at this point where we highlight the importance of pilgrimage as a form of authentic transformation, moved by a true change that could lead the person to a higher spiritual and deeper spiritual level.
In order to answer this question, the first step we have done is to do a literature review to construct the theoretical framework. To be considered an essential service has to do with health and with substantiance. So in this case, we explored the connections between pilgrimage and health in order to determine if this can be considered as an essential service. According to the World Health Organization, health has three dimensions, which are physical, mental, and social. But as you can see in the slide, in the late 19th, it was proposed to integrate also spirituality as a fourth dimension, as health is also a dynamic issue and has to move according to the society. So in this context, especially during the pandemic, many people also were looking for some kind of spirituality. This was a trend that was already that was existing already before the pandemic, but increased really during the pandemic. So our aim is to explore how pilgrimage can be connected with this. Again, following the World Health Organization, the main conditions for health and the main resources are related also to peace, to education, to food, to social justice, to equity, among others. And in this case also, we wanted to explore if pilgrimage can cover some of these aspects, for example, peace or social justice, by developing sustainable forms of tourism and being pilgrimage one of these forms. So in this literature review, we explore these connections. And as you can see here, pilgrimage can be connected with different of these dimensions of health. For example, spiritual health, physical health, and social health. In the case of the quest for spirituality and the connection with pilgrimage, it has been long explored in the academic literature, the connection between pilgrims and this quest for spirituality. And this is also connected, for example, with the search for inner peace, with this willing to connect with oneself and also with the divinity. Also, pilgrimage is connected to physical health. And in this case, as in many occasions, pilgrimage involves walking and involves different physical activities. And walking is considered also to be a healthy activity. So it's clearly, the connection here is clear. Most of the pilgrimage and walking is done outdoor, and also it's in connection with nature. So here we have another connection. And in some cases, there is a connection also with food. Many pilgrims establish dietary requirements while doing the pilgrimage. And many religions refer also to food that can be eaten or should not during not only the pilgrimage, but to be considered for us as a spiritual improvement as well. And finally, pilgrimage is connected to social health. Pilgrimage and tourism represent opportunities to meet other people. Pilgrims meet other pilgrims during their walks and during the pilgrimage, and this is an occasion to socialize. So pilgrimage is also considered to be a social practice, and it's really important also because it offers the possibility to meet locals. So pilgrimage can promote this social contact, social exchange, and also intercultural dialogue. So these are some of the dimensions that are going to be explored.
So pilgrimage is within the classification of a type of transformative and experiential tourism. It is a path that is traveled with the soul in the open. I mean, with your soul wide open, and directs you toward positive changes in attitudes and values, based on new experiences that put you physically and mentally in high conditions of the human being and puts you to the limit. So this is a path that leads us to face our past or present or future, and whatever happens in it, it will impact in your personal behavior, in yourself, in society, and also in the environment that you normally are in. So this pilgrimage takes us to the attachment part of your ego and from your old personality that brings you with the creation of new mental, spiritual, and emotional and physical state, which will provide us with well-being and with a close sense of belonging and caring and responsibility for your environment and for what it's around, what you're surrounded for. So these transformations supported by the spiritual healing allow individuals to go on this search of new opportunities that are actually increasing their desire to live a better life. So according to Gelter and Boswick, as we see in the slide, this change of experiential processes, when facing a new transformative experience, the human being is exposed to 5 fundamental processes that are physical, mental, emotional, and psychological levels. So will these processes will have an impact on the individual already, that this from a sensory perception, which is the first impact with the experience, and will generate these huge emotions directly related to their past, to their present, to their future experiences. And from here, the creation of these meaningful experiences with great meaning for those who live them is really part of essential change and need for this.
So according to this literature review and to this theoretical framework, we propose a qualitative methodology based on interviews. Ideally, we should interview pilgrims, but in the context that of the pandemic and mobility restrictions, right now it hasn't been possible. So we have started with in-depth interviews with pilgrimage organizers, coach, and local services suppliers, which are the ones in direct contact with pilgrims. In the future, we would like to interview pilgrims as well. But for these preliminary results, we haven't done this. We have also explored secondary sources like official statistics, and we have collected data among the number of pilgrims that have arrived. And right now, the geographical context is based in Spain, mainly in the Camino de Santiago, but the idea is to also compare it to other pilgrimage destinations, like, for example, Italy and Rome, or Israel and Jerusalem. So we have been in touch with different organizers in other countries to try to do also this research and compare results. The interviews also focus in what we mentioned before, the different dimensions. So the physical dimension, the spiritual dimension, and the social dimension. So according to this, we're going to present some results. The situation now, as you all know, is quite difficult because the pandemic has had a strong impact on tourism. As you can see here in the image, according to the UNWTO, the number of international tourists in the world dropped down dramatically in 2020, something that was not expected in any forecast. But as we can see here, we are counting 70%, 80% of decrease. And in this case, Spain, Europe, Galicia has not been an exception. In Galicia, the situation in the last season, in summer, after the confinement, was that there has been a decrease of 60% in the number of tourists in 2020 compared to 2019, especially affected international tourism arrivals, which were an important part of the pilgrims that were participating in the Camino de Santiago. The numbers that we're presenting here in this slide are according to the Galician government. And in this case, as you can see, some of the measures that were applied to try to revert the situation were related to promote internal market, national market, and to offer helps and grants to tourism companies. for us important, it was to this promotion of this safety level related to COVID-free level. And as you can see here in the slide, there is a special plan for the services around the Camino de Santiago, which allows us to see the importance that this pilgrimage route has in the tourist strategy of the whole region. Let's see some data from the Camino de Santiago.
Exactly. So from this data from 2019 versus 2020, we've seen a decrease of over 2,100 visitors that didn't come to Spain to visit Camino de Santiago, and mostly the visitors are coming from Europe. And then the following continent will be North America and South America also. So this decrease evidently has something to do with the pandemic, and the numbers as are decreasing. We're struggling with this because there are a lot of people that are trying to reach this spiritual path, and the impossibility to come has been a very difficult situation, not only for governments, but also for the people that are seeking for these opportunities. And then the next thing will be an important issue that we've been seeing from this pandemic. For example, the non-religious part of visitors have been increasing, which is something very important to have in mind right now, because evidently there's something happening in this part of the visitors that are increasing, not only by 10%, mostly it's actually the double, like 24% of non-religious tourists in 2020 visited the Camino de Santiago. So there's this need. Is there this need for people of seeking this path of a spiritual recovery or healing, or what is actually happening between these visitors that are becoming more interested in this path, in this Camino de Santiago or any other Camino, from a secular or religious perspective? Evidently, it will be from a non-religious perspective, but this is helpful for us, for the research that are coming from.
According to this, and according to the data that we got from the interviews, some of the results that we can see now, but we need to do more interviews and we need to do more research on this, but can be grouped into blocks, one regarding pilgrims and the other one regarding the sites and the services. Regarding pilgrims, as mentioned before, there is a strong dependence on mobility restrictions. And in this case, these restrictions are not over yet, because still we are in these restrictions. So this, of course, affects. Last day, looking at the website of Camino de Santiago, it said that one pilgrim arrived to Santiago. It was yesterday. So you can see that the mobility restrictions affect the development of this pilgrimage. But also there are some people that are trying to get like certificates to be allowed to do this kind of pilgrimage, not only for Santiago, but for other pilgrimage routes. And there was a case of a pilgrim, and this was explained by a person in charge of a hostel during the Camino de Santiago, that got a certificate from the doctor that allowed to do the pilgrimage. It was a recommendation regarding health. So in this case, we can see that there is somehow a connection between this idea of being an essential service or an essential need of people. We have seen an increase of the interest in outdoor activities and other activities like well-being, mindfulness, or even meditation, and retires as well. And even there was an interest that was seen before the pandemic. After the pandemic and during the pandemic, this has increased a lot. So we can see that there is this connection, and that they see that pilgrimage can be a form of reaching a more healthier way of doing tourism as well. No, it's considered to be more safer, for example, as well. But regarding the sites and regarding accommodation, for example, and regarding religious sites on the way, there are some also challenges. For example, there is a need to find a balance between the health requirements that have been established by the the government and the number of visitors, especially, for example, in hostels that have to reduce the number of people, or, for example, in the Cathedral of Santiago, when they have the Mass, there are some limitations in the number of people, and they have to find a balance, and they have to find ways to manage this. They have also economic difficulties because part of these sites depend on tourism income, so this is important. And finally, there is the need to find how to preserve living heritage and how to be resilient, especially regarding intangible heritage. There are many events and celebrations that are not taking place anymore because it's forbidden, or because they have to change the conditions, or they have to limit the number of people attending. So how to preserve this is a concern to many sites and managers, and this is important to take into account as well. So even we can see that it can be considered as a service that is essential, or it can be linked to this need of pilgrims. There are some challenges that has to be that has to be resolved somehow in order to be more safe. So waiting for more results, this is what we have found now. Thank you for your attention. If you have any question, if you have any suggestion, please feel free to contact us. You have our emails here. So thank you very much for your attention.
Thank you. Have a great day.